Hi everyone, very good morning. On the occasion of World Breastfeeding Week, we at Team Loop wish to welcome Dr. Pradnya Supe, a renowned obstetrician as a gynecologist and MS laparoscopic surgeon. She is also a lactation consultant. She has nearly around 14 years of experience and overall 10 years of specifically experience in her field of practice. And she practices at Agarwal Clinic, which is at Chembur. She's even attached to Zen Hospital, Surya Hospital. Um, she is very, she is very well known to be very patient, caring, actually patient friendly. Her way of handling patient and dealing with their fears, and she helps them to put them at very ease and that is very commendable. One will never see her getting irritated with any of the question, and she's always focused on patient comfort. We are very glad to have you with us, doctor. And today we are going to discuss on guidance on breastfeeding, specifically on women's health and postpartum care. So, welcome you, doctor.
Thank you so much, Charmi, for that lovely introduction. I'm also very happy to really be here, be part of this discussion. And I hope whatever pearls we discuss in this conversation are useful to all new mothers.
Yeah, ma'am. So I would like to ask you questions because there are a lot of mothers who keep asking us, and I know that nowadays doctors do not have that much of time to explain patient or guide them. So actually, there are nowadays there are so many working mothers. They have so many doubts. So with your help and with this discussion, I think we can reach out to many mothers who can actually understand the importance and guidance on breastfeeding and specifically women's health and postpartum care. So, ma'am, I wanted to understand what are the benefits of breastfeeding for both mother and the baby.
So, see, benefits of breastfeeding. Let's talk about the mother first. First of all, let's understand it is the most cost-effective way of feeding your baby. It's
Correct.
absolutely free. It's absolutely safe. You don't need to sterilize it. You don't need to clean it. The most safest way. Secondly, if you compare, cow's milk or buffalo's milk with breast milk has more protein. It has more vitamins and minerals. Also, a lot of antibodies from the mother's milk are secreted in breast milk, which go to the baby. So, breast milk gives baby immunity, prevents a new baby from getting, these viral infections, cough, cold again and again. In the long term, babies which are actually fed for a very long time, they have protection from diseases like diabetes, hypertension, even sudden infant death syndrome, cot death as we normally call it. Breastfed babies are more less likely to not suffer from all those problems. As far as benefits to mothers are concerned, yes, it does help in weight loss after pregnancy, which is one of the most important thing that mothers should understand. It prevents from a lot of cancers in the long run, breast cancer, ovarian cancer. Also, it improves, the most important thing is that it improves the bond between a mother and a baby, the mother breastfeeding, and definitely it provides the optimum nutrition to the baby as well. So that's the biggest benefit for both the mother and the baby.
Yeah, thanks, ma'am. So, also, I wanted to understand within how much time one should initiate breastfeeding, whether it is a C-section or you can throw some light on breast crawl. It's really happening in India.
Yes, it is. Breast crawl
Okay.
is happening. A lot of people do practice it. So let me first talk about initiation and then we can move over to what
Sure.
is breast.
Yeah.
So the ideal time where breastfeeding should be started is as early as within 30 minutes of delivery,
Okay.
whether it is a normal delivery or whether it is a C-section. So in a normal delivery, we are assuming that the patient is out in 30 minutes. So either by herself or with the help of an attendant or a nurse, she can definitely breastfeed within 30 minutes. In a C-section, even if she's under anesthesia, with the help of a nurse or an attendant or even the anesthetist, the baby can be allowed to suckle on the table itself. It is done, it can be done. And once she's out of anesthesia, immediately in recovery also she can again breastfeed with a little help. So what is breast crawl? So breast crawl is basically that once the baby comes out, even before the umbilical cord is cut, you do not immediately cut the umbilical cord. You put the baby on the mother's chest. The baby automatically moves and starts suckling on the breast. You know why? Because the baby can smell the mother. The basic thing is you do not wipe off the baby. You keep the
Okay.
baby, the white thing which the
Yeah.
baby is covered in. You do not wipe that off the baby. So the
Okay.
baby, understands the smell of the mother's breast, the nipple, the milk, and it automatically starts going and suckling. The biggest advantage of this are number one, that the baby is starting breastfeeding very, very early. Secondly, it helps in contracting of the uterus. So, the placenta separates smoothly at that time, decreasing the blood loss for the mother as well. So, it's beneficial from both
Oh,
aspects.
lovely. I must say that you must be experiencing this magical moments, very often, right, with your patients.
Actually, seeing a breast crawl, I wish, I mean, if I could share a video right now. I don't have it, but it's one of the most magical things to envision. The baby actually, like magic, goes and locates the breast and does start suckling. So it does
Yeah.
happen. See,
Okay.
this is obviously provided that the mother is stable enough to do all these things.
Yeah.
There are no other problems in the mother or the baby. The baby doesn't immediately need, NICU or any other care. But yes, in a normal mother and a baby, breast crawl can definitely be tried.
Okay. Okay. Ma'am, next question I would like to ask you is how does breastfeeding impact women's hormonal balance and overall health? And what are the long-term health benefits for the breastfed mothers?
So, how does it affect? See, breastfeeding is a very natural thing, and hormonal levels. See, till a mother is breastfeeding, at least in the initial approximately 4 to 6 months, if a mother is exclusively breastfeeding, the hormones in her body still remain suppressed to some extent, and she does not get her menses. So, menses can come anytime between 3 months to 6 months, sometimes in a mother who is exclusively breastfeeding, up to 6 months, and even breastfeeding to a significant extent after 6 months. It is pretty common. She might not get her periods up to 8 months, 1 year, sometimes even 1.5 years. So that is also absolutely normal, and this is how the hormones breastfeeding does affect. What is most important to remember is that even if she is not getting her periods after 1.5 months, she is still likely to get pregnant again. So that has to definitely be kept in mind. As far as the long-term benefits of breastfeeding are concerned, like I mentioned, definitely the bonding between the mother and the baby. It is the most simplest thing for any mother to do. It helps her lose weight. It helps her mental well-being as well, that she is doing a thing, that she's feeding her baby. For any mother, it's a great job. Breastfeeding requires a lot of dedication. It requires a lot of determination. So the fact that she can do it does definitely help her mental well-being and the other benefits which I mentioned a while back.
Yeah, yeah. Thank you. Uh, so, ma'am, I have seen, nowadays in the hospital, they do initiate a lot of formula milk. So, I wanted to understand what are the advantages of breastfeeding over formula milk? Like any particular thing, like, because I know each pregnancy is so precious and each baby is so precious. So, doctor also wants mother to be in the comfort zone. So, is that particular reason, or, formula milk is introduced, or, can you throw light on this?
A lot of hospitals initially, see, a hospital has to be a baby friendly hospital. So it's a
Correct.
concept called as a baby friendly hospital. One of the most important things in that concept is that the mother and baby are together. So a lot
Correct.
of hospitals still, this is really not followed. So after delivery, they do keep the baby apart. They don't immediately give the baby to the mother. The mother is being shifted from the labor room or the operation theater. So at that time, the baby is not really with the mother. So obviously, they don't want the baby to go in hypoglycemia. So the first feed,
Ah,
a lot of times formula is given. Maybe sometimes the mother is not in a state to feed the baby, on these rare cases. So formula is given. But I would really say that most of the hospitals should practice breastfeeding after maybe that first feed. But sometimes it does happen that the mother is not unable to feed or the baby is very cranky. So most of the hospital, unless they are really very pro breastfeeding, do give formula. If you look at it, many pediatricians, many gynecs also will say don't give formula, do try breastfeeding. But sometimes it's not enough for the baby. Maybe the baby is not suckling well because it's a small baby. The mother is not able to breastfeed. If the weight gain is not happening the way it should, then yes, anybody would tell them to add formula.
okay.
The mother is not able to breastfeed for some reason, she has suffered any post-operative complications, there are some other complications, then yes. But if the mother is fine and the baby is fine, the baby is not premature, the mother is fine, she's doing well, breastfeeding should be the primary method of feeding. Formula should always be an additional thing.
Okay. Yeah. Thank you. Ma'am, I have come across in my practice also that there are a lot of common challenges which is faced by the breastfeeding mothers. So, how do we overcome? Like a common challenge, I'll say, nipple crack or pain while feeding. So they refuse. Even mother becomes so cranky. She's in pain, so she actually refused to feed. So these are the common problems. How do we address them and specify them that okay, these are the common issues and we can deal with it?
Yes. So before we talk about positions, let me tell you that comes in is called as the colostrum.
Yeah.
Colostrum is nothing but, if you want a layman term for it, it is liquid gold. Why is it called liquid gold? Is because it has a lot of antibodies in it. It's very rich in antibodies and which are very beneficial to the child. So the first milk which comes in is colostrum and the quantity of it is very less. A lot of mothers believe that that colostrum should not be given to the baby or it is not adequate for the baby, and both of these things are absolutely wrong. So colostrum should definitely be given to the baby. The second thing is that uh, the position of breastfeeding as well. So most of these women, they start with the wrong position. So few things about the mother also. A new mother always tends to bend down and feed, which is absolutely wrong. Her back has to be well supported. She has to be comfortable. It has to be a pleasurable experience for her as well. Secondly, about how the baby is positioned is extremely important. So I hope this is visible.
Yeah, this is visible.
Okay, so what most of the mothers do is that the baby is like this, whereas only the head is turned towards the mother. That is not at all a correct way of feeding. So the baby's head and body should be in one line, and the entire baby should be facing the mother when she's breastfeeding. So that is one of the most important things which a mother should keep in mind. Other thing is the latch. The latch is, what I mean by latch is the way a baby takes the breast in the mouth. So imagine this is the nipple. The surrounding part is the areola. A baby's mouth should be wide open. Okay, it cannot be like this. The baby cannot be suckling only the nipple. The mouth should be wide open, this the nipple and the black part around
Ma'am,
it, which
we
is the,
cannot see this. And we will have to repeat this because we'll have to delete this, no? So we'll have to repeat this one again.
I
Yeah.
will. So imagine, is this visible now?
Yeah.
Yeah. Imagine this is the nipple. The surrounding part is the areola. What is important to remember, baby's mouth should be wide open. Okay. And baby should not be taking only the nipple in the mouth, also the areola, which is the part below the nipple. Maximum of it also should be in the baby's mouth. You should be able to see the baby suckling movements by movement of its cheeks. The
Okay.
lower lip should be outturned. And
Okay.
all this should happen when, most important, baby's head and body are in one line, completely facing the mother, and there being a skin to skin touch between the baby and the mother. So these things are most important to talk about. When do nipple cracks happen? When whatever points I mentioned right now, when the baby is sucking only the nipple or the latch is not proper, this is when nipple cracks occur. So when a mother is having cracked nipples or when she is having pain during breastfeeding, she needs to evaluate whether her latch is correct or not.
Hmm.
In our scenario, most of the times it's the gynecologist who she goes to correct this. There is a lot of awareness about lactation consultation in our society. At least educated women are opting for it. So once the latch is corrected, her nipple cracks will definitely start healing. What is most important for all these mothers to remember is that nipple cracks do take some time to heal. They will not heal on their own. It will take time. It is like a wound. She has to practice all these new things that are being taught to her. Only then will her nipple cracks heal. So that is most important. Ideally, a woman should not have any pain during breastfeeding. If she is
Correct.
having any pain, she should definitely seek help for the same.
Okay. Thank you. So, there are a lot of physical and emotional change which mother undergoes after, giving birth to the baby. So, what are those physical and emotional changes you have come across in your practice?
I think there is something called as postpartum blues. Postpartum blues is basically a low mental status, low self-esteem, slight signs of depression, which you commonly see in mothers 10 days after delivery. Basically, we have to understand that delivering a baby is very overwhelming for any new mother. She's prepared throughout her pregnancy, but she's most of the time very unprepared to handle a new baby. So it is extremely important that her entire family supports her. In our society, what happens is we only talk to the mother, we only counsel the mother. It is extremely important to counsel her family as well, especially her partner, whichever female relative is going to be around her, whether it's her mother or mother in law. They all have to understand the benefits of breastfeeding and support a mother when she goes in her journey of breastfeeding. So, commonly, I'm sure you also come across
Yeah,
these kind of families where the mother is really trying her best to breastfeed, but all these women near her are telling her you don't have enough milk, you are not feeding correctly, and the poor girl or the poor lady who's already overwhelmed feels much more depressed. So nobody should be pulling her down because she's already in a what I mean unbalanced state of mind to some extent. So, confidence building should be done mainly by her family members as well, also by whoever she's coming in contact with. That is the pediatrician, the gynecologist, whoever she's seeing. No, she should be encouraged to breastfeed. She should be made to understand that it will help her, and most importantly, she should be patted on the back that you're doing such a fabulous job, not just by somebody who's seeing her, by everybody around her, that you are putting so much effort for it. Means that will improve her self-esteem and make her more determined to continue doing it further.
so this small appreciation also works really wonders.
Yes,
Thank you. Thank you for
definitely.
this advice. Um, yeah. So I do understand that post, like, there are a lot of mothers who keep asking me, Charmi, I've given birth. How soon I can resume my sexual life? What are the measures which I need to take for my birth control, which doesn't affect my breastfeeding? So my doesn't affect my baby, doesn't affect my milk production, doesn't affect any, like, if I take any birth control pills or something like that, will that affect any of that medication will affect my baby? So there are so many doubts for the mothers. Can you throw light on this?
So let's look at the first thing. When can sex be resumed? Ideally, 6 weeks after pregnancy, because up to 6 weeks after delivery, I'm sorry, 6 weeks after delivery, a lot of women have bleeding, which lasts anywhere between 6 to 8 weeks. So after that, once the bleeding has completely stopped, is the right time that she can resume intercourse. it is important to remember that intercourse the first time after delivery can be slightly painful because she may have a little vaginal dryness. So that should not turn her off. She can definitely go for guidance. She can be given lubricants for the same. But yes, it has to be a little slow and steady. Definitely. As far as birth control is concerned, I already mentioned once that 6 weeks periods is over, even if she has not got her menses, even if she's exclusively breastfeeding, she still has a chance of getting pregnant. So yes, birth control should be practiced. Now there are some form of birth controls which can be given immediately during C-section or immediately after normal delivery. There is something called as a copper T insertion. It's called as PPIUCD, that is postpartum intrauterine
Device.
contraceptive device. So that can be inserted even during cesarean section, even immediately after normal delivery once the placenta comes out. If she goes for it, that is also a good form of contraception. If not, she has to wait up to at least 6 weeks after her delivery. So what forms of contraception can she use? She can use progesterone only pills, which are safe in breastfeeding, do not affect the breast milk output. There are certain long acting contraceptives like injections, which is called as a depot injection, which she can take, which is safe in breastfeeding. The effectivity is for 3 months, but she has to take an injection every 3 months. So they also act well. There is something called as implanon as well, which is like a hormone containing rod which you insert here. I hope this is
Yeah,
visible.
yeah, yeah.
Okay, on the underside of the arm, which has a validity for 3 years, which is also safe in breastfeeding. If she chooses to go for it, it will not cause her any other issues. The biggest problem with these progesterone containing contraceptive devices, whether it is pill or injection or rod in her arm, they do cause a little bit of intermittent spotting, but they are definitely quite effective. If she wants to go for birth control pills, at least till she is exclusively breastfeeding. By exclusive, I mean that the baby is only on her breast milk at least up to 6 months of the baby's age, no other solids, no water. She should not be starting birth control pills. After that, if she chooses to, once the baby has been started on solids, has been adjusted to solids, she can definitely start with birth control pills. Or once she gets her first menstrual period, she can get a copy inserted as per her requirement.
So all this education is given by the gynecologist during her pregnancy tenure. I can
I
think.
think I don't think so. During pregnancy tenure, I think a patient has too many questions about the pregnancy per se,
uh,
and very few questions about what happens later. But yes, we do have women now who are concerned about not getting pregnant immediately, who want to delay their pregnancy. So yes, they do ask these questions, not immediately, mind you, because immediately they are too overwhelmed by looking after their baby and everything. But yes, when they come for a follow up after 1.5 months, means normally I definitely call my patients after 1.5 months and do try and just touch upon this topic that you should think of a contraception because you want to delay your pregnancy. I'm sure most of the gynecologists do that. But yes, I think sometimes it is the till the patient poses that question to you, it does not really come from the gynec. So, but
okay.
yes, it should be talked upon. A patient should be given that idea because you really don't want her to get pregnant immediately. You want her to wait, right? You want her body to heal. So yes, this should definitely be told to the patient.
Okay. So, ma'am, I also wanted to know now, since there is a lot of awareness of lactation consultants, and mothers should seek those counselors and consultants for the better experience of breastfeeding. How, according to you, how important is their role? Can you give us that guidance on the same?
I feel that having a lactation consultant guide you in your breastfeeding journey is very important. I would not say it is essential, but see, let us remember a new mother just doesn't know how to handle a baby. It's not because she has not learned, but it's because she really doesn't know. Just because she's delivered a baby does not mean she's graduated in how to handle a baby. So she does struggle with breastfeeding. Like I said, breastfeeding, although the most natural thing that is there, is not easy. She's feeding the baby every 2 hours, sitting every time for 1 hour, almost 10, 12 times a day she's feeding her baby. She has undergone a normal delivery or a C-section. She's having backache. So yes, there are definitely problems which do arise, and a lactation consultant can correct very minor issues which can make this a very pleasurable experience for the mother as well, and at the same time help the baby to breastfeed. A few things that I would like to point at: the mother's position can be corrected, making her more comfortable. Simple correction of the latch, if she's latching wrongly or if she's holding the baby wrongly, just a simple change, just teaching her, no, this is the way you should hold the baby, this is the way your baby should latch. I'll tell you one more thing: most mothers believe that till the baby cries, baby is not hungry. Let me tell you, crying is the last sign of hunger. Means it is when the baby has completely given up. So a mother should know that there are few soft cues also which the baby can give: rubbing of eyes, putting fish to the mouth, licking of their mouth, making suckling noises. All these are cues that now I'm hungry, please give me milk. So a mother should be taught to identify them. Another thing is, a lot of mothers do complain that my baby doesn't wake up when I want to feed. So how to wake up a sleeping baby? So all these small things can definitely be corrected by a lactation consultant. The most important thing is she does have a gynaec, she does have a pediatrician, but they are concerned about other things. A gynaec will be concerned more about her condition. A pediatrician will be more concerned about the baby's condition. Nobody gives importance or time to her lactation and the questions that she has about lactation. I'm sure you also must have talked to new
Yes.
mothers of, they have a long list of questions.
Yeah.
A gynec or a pediatrician really does not have that much time to give to a new mother. But a lactation consultant will give her that time. A lactation consultant will solve her all those queries and in the process definitely help her. So yes, definitely the importance cannot be denied.
So, ma'am, I have two more questions for you. Uh, you know, I want some advice how to take care of breast health, like while feeding, while breastfeeding, and what can be the potential issues that one should monitor that closely. Like how good care. I in short, I would like to say, what is the best breast health care a mother should be taking?
Yes. So see, breastfeeding, definitely you don't have to scrub your breasts with a lot. Just washing them with plain water should suffice.
Okay.
You don't have to oil them. Even if you do not use soap for them, it's absolutely okay. If you feel they are very moist, you can just wipe them off with a soft, clean cloth and wash them with plain water. That should be fine enough. When should you be really worried? Cracked nipples, which we already talked about, because they can be a source of infection. You definitely need to look into it why you have cracked nipples and correct them and help them in healing. If there is any pain during breastfeeding, or if there's pain at any side, there's any redness over the breast, she feels very heavy and there's a lot of pain, it should definitely be looked at. Otherwise, there are any major things that need to be done. As far as wearing a brassiere is concerned, it I think it's not necessary. A lot of women do believe that it does provide them with good support, especially initially, when the breasts are very heavy, that when the body is producing much more milk than what the mother needs, if they feel comfortable wearing it, no problem. But it's very important to remember that a lot of these feeding bras are extremely tight and they can cause blocked ducts in the mothers, especially if they have a lot of milk supply and the baby is not emptying breast that frequently. So they should definitely be looking for those signs: pain, redness, fever, heaviness of the breast. All these are definitely not normal things and they should definitely look for guidance at that time.
Thank you, ma'am. And this time we have working mothers, like breastfeeding for the working mother as a topic, right? So, what
Yes.
one advice will you like to give to our working mothers? What like how they can continue their breastfeeding once they resume their work, or what is the best way to pump and store? So, your message for this working woman.
Yes, so I think it's a very difficult thing for a mother to leave her baby after 6 months. In our country, even if you have paid maternity leave, it is just for 6 months. So most of the times at the end of 6 months, you're just starting to wean off your baby and going to work. So what is most important is feed the baby before you leave for work. Feed the baby immediately after you come back. And whenever you're home with the baby, feed her as much as possible. That is the first thing. Second thing is when she is at work, she should pump at least once, twice better if she can. Now, this is if should have pumping, she should be made available pumping facilities at work, at least a room where she can feed. Now, a lot of times, what happens is women don't have these facilities in maybe small offices, so they are forced to pump in bathrooms. Not only is it unhygienic, it's difficult for a mother to continue it long term because she does find
Right.
it very detrimental. But yes, she should pump. What pump to use? Manual pumps work very well, but manual pumps obviously do cause a lot of stress on the hand. If she's planning to pump regularly and affordability is not an issue, electrical pumps are definitely better. What is most important is that pumping should start before she joins work, not after she joins work, so that she is also very comfortable to pumping. The baby is comfortable taking her express breast milk in whatever way, whether it is with a vati spoon or a palada. Bottle, I would still not really encourage because bottle feeding makes a baby very fussy at breast. So I would really not encourage that. But yes, pumping should start beforehand. Feeding the baby express breast milk should start before she joins work finally. About storing milk, this milk, breast milk can definitely be stored. It can stay at room temperature for 4 to 5 hours. It can stay in the fridge for almost 24 hours if you keep it at the back of the fridge. What is important to remember that breast milk cannot be microwaved, it cannot be boiled, it has to be thawed and given to the baby. So if she keeps in mind all these things, even simple hand expression can be done at work if she's not able to pump. See, pumping at work will have two things. One is it will not give her engorged breasts and it will help her maintain her milk supply. Whether she chooses to pump and store that milk and give it to her baby is up to her. It depends on her other logistics. So those are few things that she should keep in mind, especially a working woman.
So I think this will reduce her stress levels also, that at least she will be in comfort that at least if I'm away from my baby, at least my breast milk is only being fed to the
Yes,
baby. Yeah.
yes,
This
definitely.
will play an important. So thank you, doctor, for enlightening this topic today and helping so many mothers out to understand why breastfeeding is so important and what are the benefits not only for the baby but also for the mother. And about we spoke so many things about the contraception and so many stuff about nipple care, breast care. So I hope this is going to be really helping a lot of our mothers. I do request, in case anyone has any doubt, you can put your questions in the comment section and we'll try to reply as soon as possible. Thank you, doctor,
Yes.
for your lovely time. Thank you.
Thank you, Charmi. I hope it is a session which really benefits new
Yeah,
mothers, whatever queries they have, and more of them, if possible, to seek the guidance of a lactation consultant when needed.
yeah, yeah. Thank you, ma'am. Thanks a lot for your lovely
Thank you
time.
so
Yeah.
much.